Good morning. Today I'm going to be explaining the ins and outs of an autopsy and walking you guys through the steps of a complete autopsy procedure. An autopsy, also known as a postmortem examination, is a specialized surgical procedure used to determine the cause and manner of death. Autopsies continually advance our understanding of disease. What we learn from autopsies allows us to better understand the disease process, accurately diagnose disease, improve treatment and therapy, and potentially aid other patients who are currently suffering from a similar disease. The exam usually takes anywhere from 1 to 2 hours. Many times, experts can figure out the cause of death in that time, but in other cases, you may have to wait until a lab can do more tests to look for signs of drugs, poisons, disease, which can take several days or weeks. The medical autopsy has been largely abandoned in all places except medical centers. The number of autopsies has steadily declined over the past 30 to 40 years. It's time insensitive and expensive in an environment ever increasing pressure to reduce medical costs on all fronts. Autopsies provide an opportunity for clinicians, residents, medical students, and pathologists to learn more about the various disease processes and how they manifest in the body. The purpose of an autopsy is to thoroughly evaluate the presence and extent of human disease in patients and to evaluate the effectiveness of therapeutic procedures for the benefit of patient families and the future practice of medicine. An autopsy can be reassuring for the family. As a part of the autopsy consent process, the family has the option to place limitations on both the retention of organs and the extent of the autopsy. Autopsies may be done for several reasons, including the following: when a suspicious or unexpected death occurs, when there's a public health concern, such as an outbreak with an undetermined cause, when no doctor knows the deceased well enough to state a cause of death and to sign a death certificate, or when a doctor, family, or legal responsible designee of the deceased person requests an autopsy. There are 3 types of autopsies that we are going to be going over today. Starting with the first two, a forensic autopsy is performed with the aim of providing answers to questions about the identity, cause of death, time of death, circumstances of death, thus helping law enforcement agencies solve a crime. Although the procedure of both autopsies are the same, they are very different in many aspects. The clinical autopsy is carried out to diagnose the disease which has caused the mortality when ante-mortem efforts have failed. Many times, a clinical autopsy is done despite the cause of death having been established ante-mortem to study the disease process, thus enriching medical knowledge. So, to put that in simpler terms, a forensic autopsy is carried out when the cause of death may be criminal, while a clinical or academic autopsy is performed to find the medical cause of death and is used in cases of unknown or uncertain death or for research purposes. There are 3 types of autopsies in terms of the extent of the examination. A complete autopsy is an examination of the entire external body, along with the internal examination of all the major organs like the heart, lungs, liver, brain, or kidneys. A partial autopsy is an examination of a specific area of the body or areas of the body the family requests. Examples of partial autopsies include a chest only or brain only. The problem with a partial autopsy is that the organ examined may not be the organ that played a role in the cause of death. With a complete autopsy, the pathologist will examine and evaluate the organs that caused the disease and will report the sequence of events that resulted in the death of the patient. Lastly, a needle-only autopsy is the ultimate minimalist examination in which tissues are sampled with a biopsy needle without opening the body cavities. I'm going to be sharing with you the steps of a complete autopsy and what that looks like. The steps of the autopsy include the external examination, x-rays, internal examination, testing of body fluids, brain examination, the final procedure, and of course the autopsy report. The pathologist will first look at the outer appearance, including the clothes and accessories. They note characteristics such as weight, height, eye color, hair color, ethnicity, sex, and approximate age. All of the clothes are taken off the body until it's fully exposed, and then the skin is carefully examined. Some of the things a pathologist will look for are gunpowder residue, flakes of skin or paint, injuries, or any evidence that can be used to determine what caused the death. They will also look at scars, tattoos, or any identifying marks. X-rays can be used to assess whether there are any bone abnormalities or foreign objects in the body, and the ultraviolet light can be used to detect specific residues. This is the part of the procedure where hair and nail samples may be taken for further examination. This is the mark that ends the external examination of the autopsy. The internal examination includes the examining of the chest and abdominal cavities, as well as the brain. This is done by making a careful incision. The chest and abdomen are accessed through a wide incision, which usually starts at the shoulder, then meets at the sternum, and finally reaches the pubic bone. The incision is very deep, extending to the rib cage on the chest and is completely through the abdominal wall below that. The skin is then cut and peeled back with the top flap pulled over the face. The brain is reached by making an incision from ear to ear in the back of the skull or by a triangular incision across the top part of the skull. These incisions bleed minimally as the heart is no longer pumping blood. Before making the incision, the torso is placed on a rubber block in a way that stretches out the body for maximum exposure and optimal examinations. Following the wide incision, the ribs are sawn off to expose the internal organs. The pathologist will take note and examine the organs as they are in place before he removes them. Removing the front of the ribs allows the trachea, thyroid gland, parathyroid glands, esophagus, heart, thoracic aorta, and lungs to be removed. Following the removal of the neck and chest organs, the abdominal organs are cut free. These include the intestines, liver, gallbladder, bile duct system, pancreas, spleen, adrenal glands, kidney, urinary, bladder, abdominal aorta, and reproductive organs. The body organs are removed all at once. That is, the heart, lungs, liver, kidneys, and spleen are removed in one block and then dissected on the autopsy table. The organs are dissected one by one during the examination. The forensic pathologist will collect small samples of these tissue for further examination under the microscope. As mentioned before, to remove the brain, an incision is made from the back of the skull from one ear to another. The scalp is 1. Cut and separated from the underlying skull and pulled forward. The top of the skull is removed using a vibrating saw. The entire brain is then gently lifted out of the cranial vault. The spinal cord may also be taken by removing the anterior or posterior portion of the spinal column. Examination of brain tissue after death is currently the only definitive way to diagnose the specific neurodegenerative disorder of an individual. The information obtained through autopsy has provided family members with very valuable family medical history information. Many neurodegenerative disorders are passed through families from one generation to the next. There are several different types of disorders that require different types of treatments. Once a specific neurodegenerative disorder is known to be common in the family, physicians may better treat the surviving family members. After being removed, the organs are usually separated from each other and further dissected to reveal any abnormalities such as tumors on the inside. The organs are then weighed to detect the presence of certain illnesses. Blood samples are also taken for further investigation. Small pieces of tissue from each organ are examined under a microscope. The contents of the stomach are then examined. This is a good indicator of the time of death, as the last meal, as well as its level of digestion, can be seen and used to determine a time frame. Body fluids are tested for anything from drugs to chemical and genetic composition to infection, depending on the type of autopsy. Some of these fluids include blood, urine, bile, and eye fluid. Tissue samples are also taken of the brain at this time. Following the examination, organs are returned to the body except for the small fragments of tissue sampled for microscopic examination. The organs are replaced in the body cavities. Sometimes absorbent filler material is used to replace organs that are not returned. Once all of the organs have been thoroughly examined and either put back or preserved, the body is stitched back up. Before the organs are returned, they are placed into bags to prevent leakage, and inside the body is filled with a wool-like substance. This procedure does not disturb an open casket funeral, as none of the incisions will be visible after the burial. Precautions have been made. The absorbent bags I mentioned earlier are also called visceral bags, in case you wanted the more medical term for them. So, as I mentioned previously, once all of the organs have been thoroughly examined and either been put back or been preserved, the body gets stitched back up. The breastbone and ribs are also returned to their original positions. At the end of the procedure, an in depth report is written. This contains all of the observations made during this procedure, as well as the explanations of any of the findings, as well as the results. It also gives a medical diagnosis and a detailed summary of the case, explaining how the conclusions were drawn. During the autopsy, photographs may be taken, and this can be done for a number of reasons. Photographs of the findings can be used as evidence in court cases, and photographs of the organs or tissues can also be used for teaching and research purposes. Furthermore, some of the organs may also be preserved for more examinations, sampling, and microscopy, presentation at conferences or lectures, or used during medical training. To summarize, an autopsy is a detailed dissection of a deceased person done to determine why they died. A doctor examines the remains inside and out. They can remove internal organs for testing and collect samples of tissue or bodily fluids such as blood. Thank you.